When will Americans be vaccinated? Americans who are under 65 and healthy may be able to get their vaccinations as early as April, says Dr. Anthony Fauci, who heads the National Institutes of Allergy and Infectious Diseases. The Trump administration's health secretary, Azar, predicts that by late February, into March, Americans will be able to get vaccinated at pharmacy and grocery chains like CVS and Walmart. Here's what you need to know about getting vaccinated in the U.S. Centers for Disease Control and Prevention, CDC, guidelines submitted to U.S. states say that the nation's 21 million healthcare workers should be prioritized first, as well the 3 million elderly Americans living in long-term care homes. Approximately 87 million essential workers are expected to be next in line for the jab, but it will be up to states to decide which industries to prioritize. One of the main challenges with vaccinating the U.S. population is producing and distributing the shots. Vaccinations in the U.S. began on 14th of December, with a critical care nurse in New York City receiving the first injection of a drug developed by Pfizer and BioNTech. Pfizer, based in New York, and German company BioNTech received emergency authorization from the Food and Drug Administration, FDA, after data found their vaccine 95% effective in preventing infections. On Tuesday, the FDA reported that Moderna, a U.S. company seeking approval for its vaccine, produced a drug that is 94% effective in warding off the virus. The FDA's Emergency Use Authorization, EUA, allows a drug to be used as a treatment while studies are still being carried out to determine safety and effectiveness. Johnson & Johnson, another U.S. drug company, is currently testing a vaccine and could have enough data to submit a new request by January. The company says they hope to have enough vaccine for 25 million Americans produced by the end of the year, and enough for 50 million by March. The U.S. has agreed to buy 200 million doses of vaccine from Moderna, a company that has never previously had a product approved by the FDA. If approved, U.S. officials say the Massachusetts-based company will immediately ship around 6 million doses to 3,285 sites across the U.S., far more locations than Pfizer's initial rollout. Some pharmacies have been tapped to use their electronic networks to alert patients when it is time to receive their second shot. For Pfizer, the second jab comes 3 weeks after the first. Johnson & Johnson's experimental vaccine is the only one being developed that relies on a single jab. Even as distribution begins, the drug manufacturers must continue to seek full, rather than emergency, approval, as the FDA continues to monitor the vaccines for any side effects. Health experts say the vaccine's arrival does not mean life will immediately return to normal. A vaccine will complement the other tools we have, not replace them, said Tedros Ghebreyesus, the head of the World Health Organization, WHO. Dr. Fauci says Americans may be able to roll back those necessary precautions by the autumn of 2021 if 70% of the U.S. population has been vaccinated by then. It also remains to be seen how racial minorities, who are at a higher risk of catching the virus and dying from it, will be prioritized and what level of trust they will have in the government-issued vaccine. President Donald Trump says officials at the White House, which has seen several outbreaks, should receive the vaccine somewhat later. According to a 1905 landmark Supreme Court case, states do have it in their power to require the vaccination of their residents. At the time, Cambridge said all residents must get vaccinated or revaccinated, otherwise pay a $5 fine, which would be about $150 in 2020. In its ruling, the Supreme Court said that the rights of the individual do not trump the need to ensure public safety. However, the High Court of Massachusetts later ruled that states lack the authority to administer the injection, and could only issue fines. Private companies in the U.S. have the right to force their employees to get certain vaccines, experts say, but are unlikely to immediately do so once the vaccine is approved. This is because the vaccines are both seeking approval under an emergency process that critics say could lead to health complications. Many hospitals and health clinics require annual flu shots, and all 50 states have vaccination requirements in place for school children. Workers can be excused from a vaccine if they have health issues that forbid receiving a vaccine, or, in some states, if they have religious objections. The CDC says that vaccines purchased with taxpayer money will free, but providers may still charge for administering the jab. That fee may be reimbursed by health insurance companies or the Medicaid and Medicare programs, social safety nets for low-income and elderly Americans. The agreement also allows the U.S. government to purchase an additional 500 million doses. Billions of dollars have also been promised to other drug companies in the event that they are able to bring additional vaccines to market. States are also racing to acquire ultra-cold refrigerators that are capable of storing the Pfizer vaccine, which must be kept at temperatures of 70 C, -94 F, and is being shipped in packages of dry ice. COVID-19 vaccine, allergy warning over new jab. COVID vaccine, what you need to know about vaccine safety. How will we keep the COVID vaccine at a cold enough temperature? Safety data on Pfizer jab released by U.S. Warnings are in place in 14 states, with up to 2 feet of snow forecast in Pennsylvania and New York. Melbourne Towers lockdown breached human rights. Korean Lantern Festival gets UNESCO honors. COVID, Melbourne Towers lockdown breached human rights '4.